Hi, everybody. I'm Catherine Nero. Welcome to the Northern Kentucky Chamber of Commerce. We are talking about safety. Coronavirus. We're all stays healthy and stays safe, but that doesn't mean you don't get the workplace safety live stream. So today, field for 27 years, and Dr. Keller, are you there?
Having me today.
What?
Asthma to work injuries to prevention by means of truck driver physicals and ergonomic assessments. And also we will probably be talking about coronavirus today, I would imagine, because that is the hot topic. But anything that relates to treatment of those conditions is what we are.
Well, let's talk about coronavirus and how this kind of works itself into occupational medicine. Tell us your experience so far.
Well, you know, we all identify ourselves by what our occupation is. You know, we're an IT person, we're a physician, we're a teacher, we're a restaurateur, we're a truck driver, and all those things are completely disrupted now, as we know. You know, small businesses are hurting, small businesses are trying to figure out ways to keep going. And it's incumbent on us to do everything we can to prevent the illnesses that is the coronavirus, to limit that that transmission, to try to flatten the curve, if you will, which is something you hear a lot of that I'm not sure people understand all that well.
Let's talk about that, because we see the pictures and we see the spike, and then we see the hump, and that's what we want to get to. So explain to us what we need to do to make sure that the spike doesn't happen.
Well, it's an interesting story. That information really came from 1918 Spanish influenza during World War I. And they were having veteran war bonds parades, and Philadelphia opted to go ahead and have the war bonds parade. So they had this is October of 1918, they had about 200,000 to 300,000 people elbow to elbow in downtown Philadelphia for the parade. Mm-hmm. So within 2 weeks, they had 4,000 people dead from the Spanish flu. They had that big spike we saw. The 31 hospitals of Philadelphia were overrun with ill and dying flu victims. They couldn't take care of the other things that need to be taken care of that a hospital does. St. Louis is the flat curve that you see. They had a very proactive, very aggressive health commissioner who closed down schools, closed down churches, closed down restaurants, with the idea being to separate people as much as possible. We want to have people not as able to transmit the virus to each other. And that actually is the first experiment of social distancing, and it was very effective. So the Philadelphia curve is that high, sharp curve. The St. Louis curve is that low, flat curve that did not overwhelm the hospital system, had less fatalities per 100,000 people, and was just a very effective means of good public health. And that's been used and recommended in influenza and various other epidemics and pandemics since then. This is an exceptionally transmissible virus, and so it's being emphasized even more now, the idea of social distancing.
So when we talk about occupational medicine, what does that mean for us in regards to the coronavirus?
For occupational medicine, it means we're trying to prevent. For our client companies, we get a lot of questions about can people come into work? Should they come into work? What if they have a fever? What if they're exposed to someone who they think traveled overseas? And these kind of several degrees of separation sorts of questions. What about how can companies thin out their workforce and still keep running? There's a really good reference I'll refer you to. It's OSHA 3990. That's 3990. It's a great publication about how businesses can prepare for the coronavirus pandemic.
What are you suggesting to the companies that ask you these questions? Are you saying, hey, everybody go home and work from home if at all possible?
If at all possible, that's what we'd like to do. We have a lot of manufacturing companies that are trying to keep up production. A lot of warehousing companies. Think about Kroger. Kroger has thinning shelves, but their warehousers need to get things back onto the shelves. The truck drivers need to be able to take things out. So, 6 foot spacing. If you feel sick, stay home. If you have a cough or fever, stay home. Again, basic public health preventative measures are very, very effective for this.
Aside from coronavirus, and I know that's at the top of our minds because that's all we've been talking about for the last couple of weeks, but to occupational medicine as a whole, how do you decide whether, let's say, an injury or an illness is work-related?
Well, illnesses, let's take an injury. That's the most common example. It has to have a mechanism of injury. It has to make sense. If someone slips and twists their knee, how did they twist their knee? Did they fall and hit their knee? Giving a good history is really important, as in most cases of medicine. And then the examination, we look for objective findings. We want to see that there's looseness or bruising or whatever that's consistent with the mechanism that's described with us, or to us rather. And you can't always tell, quite honestly. If someone has a sprained ankle, they have a sprained ankle. And could it have happened another way, another time? It's hard to tell. But if they give a history that's consistent with that, then we have to believe that it's likely that is what happened. And usually the company will then investigate to see if that injury event occurred as described by the worker.
So if that's the injury, is that an illness treated in much the same way then?
Much the same way. There's an expected way that a given substance will cause an asthma or a skin reaction. And so we can expect those to behave in a certain way. And we would expect that mechanism of injury to make sense with that too, that mechanism of exposure, if you will.
Excellent. Now, for those of you watching, if you guys have any questions for Dr. Keller, please send them in. In fact, Jeremy, you've got one right now, a question for Dr. Keller from a viewer. Well, I can't hear Jeremy, so we'll move on. But Jeremy, if you've got that question, you can either ask it or just text me.
I got it.
I'll get it. Oh, there you go. Great.
Yay. Okay, so what is better, washing hands with soap and water or hand sanitizer, and can I carry it in my pocket?
You can carry hand sanitizer in your pocket. Soap and water is more effective. It's always better. I would use hand sanitizer as a time when you cannot get to soap and water. But a good 20 seconds to 30 seconds of hot water, warm water, soap and water, it's really the friction of rubbing too that makes a big difference.
Awesome. I got another one for you. Will I be drug tested if my employer sends me home from work because they think I have coronavirus?
It's a good question.
I think that would go along. I think that would go along with whatever the company's return to work policy would be. I would think they would not drug test you as you leave, but I think they would depend. Some companies, if you're out for a certain number of time, will have a policy of doing drug testing and an evaluation upon return to work. We are advising companies, and OSHA is advising this too, not to have workers required to get a note from their doctor that they're returning to work or that they had the coronavirus or whatever. We want to do everything we can to keep the healthcare system free, and that's an unnecessary step. So back to the drug screening, I think, again, I'd say that's up to the company's individual policy, and I don't know for sure it'd be based individual basis.
Awesome.
And so, do you have another one, Jeremy?
That is all for right now. I will let you know.
Okay, great. So again, if you have any questions, let us know. So I'm curious, Dr. Keller, for those of us who have now these kind of non-traditional work environment, right? So, I mean, I'm sitting in my home. A lot of people do the same. What if an injury happens while you're working, but you're at home? Do the same rules apply?
Wow, that's an excellent question. That's really uncharted water. I don't know.
I just thought of it.
The short answer is I don't know. It depends. I would think if what you're doing is in the normal course of your job, because that's basically how most workers' compensation is broadly outlined. If you're doing something that's in the natural course of your job, then that would be something that would probably potentially be addressed. If it's just that you're home and taking care of your kids' schoolwork, which of
the
course
dog
is
or whatever, yeah, exactly.
Yeah, that would be different, but. That's an excellent question. I think the jury's out on that one.
Let's talk about folks recovering from injuries in a traditional work setting. Do you say, go home to recover from an injury, even if you can continue to work?
We hardly ever do that. To my mind, light duty return to work is part of a person's treatment plan. I think that they do better socially, keeping in their work setting. They remain flexible, they remain mobile. And in fact, in some companies that will take a worker off work completely and then have them go back to work full tilt, if you will, that's hard to do. Someone may be off for 2 or 3 weeks and then go back to something else. They may have an injured knee and then have sore shoulders after being off for a couple of weeks just from being out of shape. So we strongly advise return to work light duty. We make restriction recommendations for patients and hope the companies stick to that and can find a light duty position for that person. Now, I think sometimes companies believe that that their worker is going to be on light duty for a long time. We don't do that. A week or 2, maybe 3. They should be getting back to around the full tilt of things with most injuries that happen at work.
So is that then the safest way that you guys return employees to work is kind of a gradual light duty?
Absolutely. It's the safest way. You base it on what the person's activities are. For a shoulder injury, for example, you want to avoid someone lifting over shoulder level to let that muscle relax. But they can do a lot of things at chest level, waist level, and do a lot of walking and other tasks that person is perfectly capable of doing. So we are very specific about the restrictions recommended, and we do ease those up as the person gets better.
What about preventing those injuries before they even happen? What do you guys suggest for that?
I love occupational medicine because it has all those aspects. We treat acute injuries. We treat people getting back to work after a heart attack or whatever it may be, make sure they can get back and do their job. And if we see an injury, a shoulder injury somewhere at a company, that gives us an idea that there may be a problem there at that machine, at that position. So we can prevent further injuries in that job group. But then you can step it back a little bit more and say, well, what could we do to prevent, even before that? And drug screens come into play for that. Screening examinations. We can do a job placement assessment to see if a worker is able to do adequate lifting, has adequate strength and agility to meet up to what the job descriptions are. And then even a step back further from that is wellness, keeping a healthy workforce. I think we all know that athletes, when they are better conditioned, are less likely to become injured. And the same happens with workers. If you have an out of shape, chronically unhealthy workforce, they're more likely to have injuries among many other problems. But if you can keep a healthier, active, fit workforce, they're going to probably be more productive, and they're certainly going to have less injury problems. So wellness training, wellness programs are all part of that as well. So that's the beauty of occupational medicine. You're preventing things. If things fall through the cracks and do happen, you're trying to prevent more sideways things from happening in that position. You're trying to get that person back to work quickly. And then you're trying to get someone who maybe, that poor person maybe did tear something in their shoulder and have to have shoulder surgery. Let's get them back to work as best we can in the safest way possible. So it's really, in that way, it's a little bit like family practice, because you have the full gamut of their occupational experience that we're taking care of.
That's really interesting. And in fact, so interesting, folks got some questions for you, Dr. Keller. So Jeremy, you've got a couple of questions as well from the viewers.
Yes, I do. So these are both going to be back to coronavirus related. So if I have a work injury and find it hard to move, does that make the virus worse? And then also, can my company be made to shut down because we have too many employees that have the virus?
The answer to the first question is no. The coronavirus is not going to be made worse by your inability to move. You'll probably a lot of people with coronavirus that really have a bad case will be unable to move, because a really bad case affects the lungs and they're hospitalized, and it's truly awful. As far as closing down your company, yes, I think they can, and we've seen that already with schools, restaurants, bars and restaurants, and that is something that as a public health measure could be done. That's why, again, referring back to that OSHA 3990, one of the things they recommend is trying to split your workforce, trying to even create stagger or alternate shifts so that you have a thinner, think of less people, in the area, in order to prevent, to make it less likely to transmit the virus back and forth to your coworkers. So I think there's some public health measures that can be taken, but certainly companies could be required to close down, and we've already seen that some have been.
Excellent. Jeremy, those two questions, that's it? You got any more? I guess that's it. Okay, so Dr. Keller, there's a couple of other questions for you as far as, for somebody who may be wanting to report a workplace injury. Any suggestions to them what they need to do to make sure they're doing everything by the letter of the law?
The biggest thing, or one of the not the biggest, maybe one of the most common things we see is that employees have an incident at work, maybe on a Thursday or Friday, and they start feeling worse over the weekend. And then they may go seek medical care, but they never report to their company at the time on that Thursday evening, say. So it's important that the companies follow the procedures, that they report it that their workers report to the company, follow the procedure, and then the paperwork gets started, and the company is more likely to be on board. They rightly want to know what's going on from the outset to see what we can do to keep things going. And companies should be in charge of that train and be able to drive that to the way it needs to go. So that's probably the best thing workers can do, is report it, and then the company will likely have them come to see us to check and see what's going on and see if it is work related or not, and go from there as treatment may be necessary.
Excellent. And Jeremy, just got a couple more questions from our viewers as well. Jeremy, what are people asking?
All right. Do you foresee worksite health fairs addressing more communicable virus issues? This is the first question. I'll let you answer that.
I do. I think that education component, maybe not so much work fairs, it could be incorporated into work fairs, but also just training sessions, because people have been warning about pandemics for years. It's going to happen. It's not an if, it's a when. So I think any education about these measures will be important, and it's too bad it couldn't happen sooner, but it should be a part of a health fair or some sort of an annual training program. I believe that is a good idea.
Awesome. And then this one is, how do I get my company involved with St. Elizabeth Health so I can have up-to-date information about work health issues?
Well, let me give you a couple of resources here. Our main contact is Sarah Fowler, and her business phone number is 301-2574. If you have questions or issues and you want to email me, that's fine. I'm james.keller@stelizabeth.com.
Excellent. All right, Jeremy, thank you. And I know a lot of folks, Dr. Keller, have been wondering as well about CBD oil. And there's a lot of anecdotal discussion about, oh, if I take CBD oil, I'll test positive on a drug test. What are you finding? I mean, I know it's unregulated in many cases, and that may be a big part of it.
CBD oil is unregulated. It should not have enough in it to turn one positive for on a marijuana test. The important thing to know is it is not a recognized medically explainable cause. So what we're looking for any type of a drug screen is a reasonable medical explanation or verifiable medical explanation. And CBD oil is not verifiable in the way that a prescription for medication would be. So if someone tests positive for marijuana and happens to use CBD oil, they're still going to be positive. So I guess the bottom line is CBD oil shouldn't turn you positive, but it's an unknown what contaminant be in there, and it's possible it might turn you positive. So
if you're drug tested, just be aware of that, right?
I think you should be aware of that if you're subject to drug testing.
Absolutely. Speaking of drug testing, do you have any unusual stories or incidents involving drug testing you want to share with us?
I've seen everything, from people explaining a marijuana positive that my sister was going to prison, and so she put marijuana in the brownies we all had. There's a federally prescribed program or procedure to collect a drug screen, and people will hide various types of containers containing urine in various places on their person. I won't go too much more into it than that. And it's sort of amazing to see the creative lengths people would go through. And maybe they would be good employee because they are pretty bright sometimes.
Are there any questions that you are asked more often than any other, either from businesses, employers, or from the patients?
I think the main thing we do, is educate patients about their bodies. I think in general, doctors tend to talk in Latin too much, and you feel like you could die from a lumbar myofasciitis. That sounds like a horrible, horrible condition. But if you explain to someone, well, you have a sore muscle in your back, you strained it, it's a lot like a muscle sprain would be in your calf muscle. Here's some things you can do. If you treat it like your calf muscle with some stretches and some heat and massage, it's going to get better. But we're going to keep an eye on you, and in case it doesn't get better, we'll be on top of it. No, but most of the time that's going to get better and loosen up, and you're going to feel a lot better. And I think taking the mystery away is a big, important part of what we do. And I think the kinds of questions I get are, is this going to bother me the rest of my life? Is this going to be something that's going to need surgery or keep me from working or keep me from playing with my family, my kids? And just the reassurance of the objective reassurance. If there's something there to worry about, we'll tell them there's something there to worry about. But if there's not, there's not. So I think that reassurance is something that most patients are looking for. Just objective facts, kind of like what people want with the coronavirus. They just want to know what's going on and what they can do in layman's terms to help themselves. And most people do want to help themselves get better. There's a few that don't, and we're equipped and trained to handle those and recognize those. But by and large, most people really do want to get better. get back to work and get back to their family lives.
You mentioned coronavirus again, and I know a lot of folks are asking that same question. I'm curious, for a doctor, board certified in occupational medicine, how has your work situation changed? What precautions, or, I mean, obviously you're in an office, so you're not working from home, but how has your workday changed?
We've developed a screening procedure about patients if they have symptoms or fevers to call them the day before and have them reschedule. We have instituted asking those same questions and taking temperatures at someone comes in, and seeing how we need to handle them. Otherwise, it's just the usual, a lot of hand washing. I may wash my hands a couple more times before I go home after all the patients are gone, because I certainly don't want to carry anything home.
Sure.
But otherwise, not a whole lot different.
So, I'm curious also for folks coming in, and I know that the state has, the state medical board has said, no elective procedures, that sort of thing, even down to dentistry and things like that. What constitutes an elective procedure? I'm curious, but especially with a workplace injury, it might very well seem elective, but cause a lot of pain. So at what point is it okay to have these elective surgeries during this time frame?
I think most workplace injury surgeries, unfortunately, are going to be considered elective. I think that's still being defined by experts at this point. But if you can deal with the pain, do physical therapy, and wait for the elective procedure for our example with the shoulder injury, your rotator cuff tear, you may just have to deal with that for a while until the elective surgery ban is over. They really want to have hospital space capacity available for those that need it, and still be able to treat the auto accidents and heart attacks and things that really do need to have access to the procedure and operating rooms.
Excellent. And Jeremy's got another question from a viewer as well. Jeremy?
Yep, I got two more. Does St. Elizabeth Health come to businesses to do seminars on how to stay healthy on their job?
Yes, they do. And that number to help with that is, again, Sarah Fowler's that I gave earlier.
Okay. The second one is, how can St. Elizabeth Health help HR and safety managers make their work site healthy and have less accidents?
We could, healthy would be wellness procedures, wellness seminars, health fairs, those sorts of things. Doing the other things that would help are doing walkthroughs. We can walk through and see how things are, or do an ergonomic assessment. Even some of our people can. So both of those things can help.
Excellent. You've given that information, Dr. Keller, where folks can find you. You want to do it one more time for those folks just tuning on in?
Sarah's phone number is 301-2574. And my email is james.keller@St. Elizabeth, it's St. Elizabeth, no period in there, .com.
Excellent. Dr. Keller, thank you so much for taking time. I know coronavirus is on the top of folks' minds, but there's so much else to discuss when talking about occupational medicine. We appreciate you sharing your expertise with us.
It's my pleasure. Thank you.
All right. And thank you guys once again for joining us. Every month we're going to be doing this. Yeah, this one looks a little bit different. We're not in a podcast studio, but we're still getting you that important information because so many people have to continue working no matter what is going on in the outside world. It may look a little different. It may seem a little different. It may sound a little different, but we'll be here for you to share the great information with you. Go ahead and hit share on this so we can make sure that more folks know all about the expertise that Dr. Keller shared. And we will see you back here next month for the Workplace Safety live stream here from the Northern Kentucky Chamber. Thanks, guys.